Hello and welcome back for another webinar with MetaPhy Health. I'm excited to be chatting today with Chris Oubre, the Chief Operating Officer at MetaPhy Health, and Tammy Sims, who is the Revenue Cycle Director at Digestive Care of Evansville. We are going to be talking a little bit more about the hidden revenue in your patient panel. Tammy is a billing expert who is probably one of the most knowledgeable and insightful people that I have met in revenue management. She's going to be sharing a little bit more about how she's helped her practice drive towards more profitability, efficiency, and partner with the right outside vendors like MetaPhy Health for creating some ancillary streams of revenue. So, welcome to you both.
Thank you.
Before we dive in, why don't we do some quick introductions? I know some people on the webinar are going to be familiar with who both of you are, but not everybody. So, Tammy, would you like to just give us a little intro to who you are and what you do?
Sure. I'm the Revenue Cycle Director for Digestive Care of Evansville. We're located in Southern Indiana. We have two medical offices and two ambulatory surgery centers. We are still independent, not hospital owned. We I have a team of 25 that works under me. We do all of the billing, collections, benefit verification, prior auths, etc. Everything for all three of our centers, and I've been with them for almost 8 years now.
Wow, it's a long time. Chris, tell us a little more about who you are and what you do.
Chris Oubre, President, Chief Operating Officer here at MetaPhy Health, and really glad to be here with both of you today. I've been in healthcare now almost 28 years, I guess. Time goes by quickly, I think. During that time, a lot on the technology side of healthcare, and then the last probably 15 years on more of the operations side. And so we started MetaPhy Health back in 2017, really with a focus on three things. We wanted to create a business and a platform that was clinically valuable for patients, that was operationally non-disruptive to practices like digestive care, where Tammy is. And we thought if we could do those things, we could create some good ancillary revenue sources for the practice, but also save patients money, save the overall healthcare system money. And so today we're managing, 35,000 patients a month, and we've got 600 providers all over the country, and have really been able to check those boxes. And so we continue to focus on that, and are really happy to be here and be doing this today.
I think one of the things that I've learned from you, Chris, over the last year or so is that there's so much opportunity to increase revenue for a practice in the right ways without increasing overhead. And that will be a great conversation for us to dive into today. But before we do, I know that both of you have mentioned that many specialty practices are kind of unknowingly leaving significant revenue on the table every month. And what you've seen, Chris, at Tammy's practice is that they are really intentional about making sure that they're not leaving that revenue on the table. You've described them as a well-oiled machine. And I was thinking maybe you could give us a little bit of a sense of the scale and sophistication of what's happening at digestive care before we dive into that revenue conversation.
Sure. No, happy to. And digestive care has been a great partner for us, but Tammy specifically has really been a great subject matter expert for us throughout the partnership. And it's unusual. It's unusual for a site in Evansville, Indiana, to have the level of sophistication that we see. We work with practices all over the country. Some are very large, some are private equity backed. Others have lots of resources to help them, but we've seen very few with the level of sophistication that Tammy and her team have. They really have strong positions. They have a strong operations team. They have a super strong revenue cycle team, and they're really focused on patients and taking care of patients. And so that's really philosophically where we align with them. And I would say, they're not a practice who's trying to play catch up. They're really leading in lots of different ways as we think about the entire operations and revenue cycle process. So with scheduling, with coding, with collections, and ultimately, patient satisfaction, patient experience. They're doing some really good things. So I just think it's worth noting that doesn't happen everywhere. We certainly don't see that in all the places that we have partnerships, but it's a great one here, and I think they're seeing some of the results of that.
And you did mention a little bit about the operational side of what is happening at Digestive Care. Tammy, I know that you're managing a lot, both in terms of revenue management and operations. At a high level, can you just give us a look at what your day-to-day looks like? You have three different businesses that you're managing, but you've also put all of these different tools in place to make sure that the clinical side of the business is running really smoothly. And I think that we want to highlight the work that you and your team have put into creating this really seamless operation that is really quite wide.
Yeah, it takes a dedicated team of billers to keep track of it all. So we have separated duties more by insurance type or activity than by patient, so that each person only works specific insurances in each business unit. This not only limits the load on each person, but it also allows them to become the expert per se in their respective insurances. For tasks like answering phones, posting payments, or collections, those activities are done by the same person in each business unit, so everything stays consistent. And then the key is to balance the workload among your people in a way that keeps them busy without overloading them while still allowing them to be the expert in their particular area.
I think that's great advice, and I think it's almost comes back to keeping it simple. You don't need to reinvent the wheel with every new process that you're implementing. It's really just keeping that consistency across your team.
Absolutely, yes.
So, piggybacking on that question, Tammy, your practice has kept everything in-house at a time when many groups are outsourcing revenue cycle. What made you want to hold on to that function, and what does it take to do it well?
Well, our metrics show that we are doing our job well. Over the past 7 years since I've been with this company, we've continually increased our profits while improving our metrics. So, this shows that we're actually collecting more money, not just adjusting off unpaid claims or bad debt, but we're still keeping denials low, bad debt low, and days in AR low. Again, it all goes back to having a dedicated, well oiled team of billers. I work hard to keep them encouraged, to support them with both providers and patients, and make sure they enjoy what they're doing so they'll want to work harder and stay with the company long term. I have very little turnover in my department.
Chris, I know that's pretty unique for a specialty practice to have someone that can run a revenue department with that level of sophistication and the that level of seamless operation, but then also have someone at the helm that's really focused on leadership. What do you think other practices could do to kind of mimic that model a little bit more in their own organization?
Well, I mean, again, it starts at the top. So I love that Tammy gives a lot of credit to the billers and the folks that work on her team, but really just, her setting the vision and setting expectations and all of the things that have to be in place, I think is really the first step. And it's rare. It really is rare to find a team like this. We see revenue cycle folks that are focused on just the transactional tactical components of billing and collections, but we rarely see someone that's really more strategically focused on how that fits into the overall operations at the practice level. So seeing an organization like this where the practice, they have strong fundamentals, and they're doing things the right way, and they have the checks and balances in place to make sure things are being done, and they're constantly thinking about how do we do it better, is just really unique. And so they're looking at what they do in the surgery center. They're looking at what they do with anesthesia. They're looking at what they do in some of these sort of more typical ancillary service lines inside of a practice, but also looking at things like chronic care management and remote patient monitoring and things that we do at MetaPhy, as just more strategic ways to provide good value and clinical care to their patients and create a revenue source. So what we see there is pretty unique.
You touched a little bit there on some of the ancillary lines of revenue and some of the and how that compares to the more typical services that a digestive care center is offering. Tammy, when you think about the changes that are happening for specialty practices right now, specifically in GI, insurance companies are actively driving patients towards ASCs and even sometimes providing financial incentives for keeping those procedures out of a hospital setting. What do you think that that means for practices that have invested in building that infrastructure? And how are you looking at that over the next 5 years as a line of business or how your business model will change?
Well, owning an ASC is much more upside than downside in this age of insurance accountability. As you said, many insurances are driving patients to the ASCs and away from outpatient settings, while some are even incentivizing providers to do so. So, by having ownership and that driving force, we see higher volumes of patients in our ASC, which results in higher reimbursements in our pockets. It's also driving hospitals to partner with independently owned ASCs to help recover what they're losing from lower outpatient volume. This brings higher fee schedules to the ASC, which increases profits for both parties.
And you mentioned reimbursements there, Tammy. Chris, CMS reimbursements are changing, and that change is probably going to become more prevalent over the coming years. How are the practices that you work with responding to that? And where are you seeing the most vulnerability in a procedure-dependent revenue model?
Yeah, I mean, everyone is clearly seeing that, reimbursement pressure is real. And so I think it's becoming more and more real every day, and practices are seeing it. Margins are decreasing as labor costs go up, and inflation, and again, and all of the sort of payer related friction that exists. And so I think a lot of practices, and Evansville is one, are really trying to do some of these things to diversify their revenue streams so that they're not dependent on one or two clinical services to provide to patients. They have a little more flexibility and some more options. So we're seeing that a lot. And then I think the other thing they're doing is looking for things that other service lines that are clinically valuable to their patients, but are also financially valuable to the practice. And there are those things do exist, right? We MetaPhy is an example of that. And so having patients that you can see and provide a host of services, continued service, longitudinal service is not just an episodic experience with a patient. They come in for a colonoscopy and then they leave, but really thinking more in terms of managing these patients long term. To me, is just a much better model, a more resilient model in these times of reimbursement challenges.
One of the things that both of you have really highlighted so far in this conversation is the need to balance a focus on the financial model for the practice along with balancing a patient first model for the practice. And I think that that's something that Evansville does so well. Tammy, this is a little bit of a curveball question, but um, how are you guys maintaining that balance? How do you maintain that focus first on the patient and then also look at it from a perspective of what's going to help the practice do well and stay in business long term?
Well, we've done this several times over the last few years. We recognized several years ago that our patients were paying so much out of pocket for infusions, getting them done at the hospital. And then the hospital switched to one medication. So they were giving every patient the same medication, and not every patient is the same. So we decided, why not? Let's do our own infusion center. Not only is it a profitable business, but we can give the patients the medications that they need. We can do it cheaper than the hospital can do it. There's copay programs out there for the patient that will help with these expenses. So not only do we save the patient's money, they get the treatment that they need and not some cookie cutter treatment that the hospital wants to give them, but it also puts money in our pocket because there's money there to be made on things like that. So that was just sort of one thing. Chronic care management was another one. You know, how can we get our patients better treatment, get them the care that they need that's not going to cost us more, or that's going to bring in more money than what it cost? Chronic care management was one of those things. So we're always looking at new avenues and ways that we can treat our patients better and get them on a better path of healing while still either breaking even or making money.
Yeah, that's a really great point. And you mentioned you kind of led us nicely into that topic about chronic condition management. How did you, as a group, decide that CCM was a service line that you wanted to pursue?
Well, it's kind of a twofold decision. So, one, how chronic care management could improve the health of our patients, and two, how chronic care management could increase our income. So, Medicare made it clear a few years ago that they're not only paying for this new service, but they're encouraging providers to use it in hopes that it would lower overall patient spending as their health improved. So, for us, it was sort of a no brainer. When we look, these people will do it for us. They charge a flat rate. The reimbursement's more than that. We can not only take better care of our patients by using them, but it's also a profitable business and it to boot.
How did you decide to create a partnership? What was your decision process like when you decided to partner with MetaPhy over building a CCM program in-house?
Well, the first thing that we do is we look at cost. So we look at what is their cost versus income. What would be our cost to do the same amount of work? It would cost us way more to train someone, to pay the benefits, to do all of that, than what it was going to cost us to have MetaPhy do that. So it was sort of, the profit margin was much greater having a company like MetaPhy who already knows it. They've got the process down pat. We don't have to learn it from scratch, hire people to figure out what they're doing and track that. They've got that well-oiled machine. They're already doing it. So we were sort of, like I said, a no-brainer to get in touch with them and sort of, get in collaboration with them.
Yeah, I can see how that would influence your decision, especially just knowing both of you now. I can see also how your values really align in terms of how you run your businesses and the way that you manage people, and the leadership at both companies is very similar. But when we talk about, Chris, what this looks like at a practice level, and we talk about revenue versus expenses, and what that income stream actually looks like for a practice. Can you talk a little bit about what a practice could expect in terms of revenue from a CCM partnership with MetaPhy Health, and how that process works and what patient care actually looks like when you partner with MetaPhy?
Sure, sure. And I'm actually going to go back to just a couple of things that Tammy just touched on, just because I've heard her say these things before, but they sort of resonated nicely, even again today. And I think one of the things she has said over and over today around, doing things right, providing patient care, and looking for good, ancillary revenue sources. And I think that's, again, unique for them, is it is an and, it's not an or, right? There are ways to check all of those boxes. And so, to answer your question, that's really what we've tried to do here. And again, we touch it from all three components, right? We know it has to make sense financially, but we also know that, practice staff and administrators have full-time jobs, and so it's hard for them to take on other responsibilities. So to Tammy's point, we do sort of have a well-oiled machine here in the MetaPhy world, because it's all we do, right? So think of us as, we look at this as, 2 inches wide and 2 miles deep, where at the practice level you're looking, 2 inches deep and 2 miles wide. And so just having someone that's waking up every morning thinking about this program and how we can provide these services to patients on behalf of the practice is what we do. And so again, if we do well clinically, if we do well operationally, it does create a good financial revenue source. And that all depends on just the patient volume. But it's not uncommon for providers to see at a steady state 100 patients in the program that we manage on a monthly basis per provider. We see some with triple that, right? It sort of all comes down to the level of engagement for the physicians and nurse practitioners, and also the number of patients they see. But for those folks, they can see, a six-figure, number in profit, not revenue, to the practice on an annual basis. So it's not insignificant. Back to the questions earlier around, reimbursements are harder to see these days, and everyone is looking for things that make good financial sense. And so I think this is one of those things. When done the right way, with the right partnership, with the right focus, it can be good for all parties involved.
One of the things that you mentioned is that I think a lot of practices would want more detail about, or would be thinking about as they considered CCM as a potential revenue stream, is what is the cost to my practice? What's the administrative cost? What's the lift? What's the overhead that I'm going to have to invest in a program like this? Um, Tammy, do you think that there is a heavy lift to implementing this program and managing this program for your team, or is it fairly seamless?
Yeah, since chronic care management is primarily for Medicare and Medicare commercial patients, those insurances pay fairly quickly on these with very few denials. So it really isn't much extra work for my team at all.
Okay.
However, the financial benefits that we receive from the program have definitely made a difference in our bottom line. It is a scalable, profitable service.
And is it easy for your providers to refer patients into the program?
Yes, it's very easy for them to refer it. And actually, MetaPhy works within our EMR system to pull out those eligible patients. So once we've seen that patient and they recognize that, they can real quickly get them enrolled in the program with very little effort on the part of our providers.
So, what I would be thinking about if I were a practice owner or an administrator listening to this right now is that's great, but everything that we've talked about today has been how special your practice is and how much infrastructure you have set up and how many systems you have in place. Do you think that it's still simple to implement this program if you don't have that level of sophistication within your practice and you're really just looking towards the future, to try to bring more of that organization and those ancillary revenue streams into your practice and those opportunities for your patients to have better access to care? Or do you think that this is really only seamless for organizations that have the level of sophistication that your practice has?
No, I mean, this is something that just about any practice could implement. So we have a lot of longevity with our physicians. They're always open to ways to make more money. That's one bit of having a fully physician-owned practice. They're always looking for new streams of revenue. Of course, it has to make sense that the increased revenue is worth the time invested, but for chronic care management, it very much is worth it.
Well, I'm gonna say this, just from a business standpoint. If the only practices that we could work with were as sophisticated as Evansville, that's a really small market, and I'm not sure there's a business for us here. So unfortunately, we have to work in environments where the level of sophistication and experience, et cetera, is not, quite that high. And I still think we've been able to do it with a high level of success. But there's no doubt that the results, again, that these folks see, and Tammy and her folks see, and the providers see, is substantially increased when you have this level of sophistication, this level of engagement, and this level of leadership and professionalism throughout the practice. So it certainly makes it easier for us.
If there are practices out there that are thinking that this is something that they want to do on their own, what are some of the common roadblocks that you've seen practices encounter when they try to run a CCM program in-house versus working with a partner that integrates directly into their systems?
Yeah, we've seen folks try it, and just to be honest, with very little success. Even really large, again, private equity backed practices have struggled. And what I've seen, really one of three things happens. The first is it just sort of becomes an extra thing that someone is dedicated or assigned to, and they might get to it when they get to it, and it's just not a point of focus, and so it really just sort of stalls out, and sort of nothing really consistently happens with the program. The second is, folks realize that there are some compliance issues there that unless you're thinking about this and really staying on top of it, from a quality and a compliance standpoint, it just becomes difficult. When you think about, tracking and auditing and consents and maintenance and all of the billing issues that are involved, it just becomes complicated if you're not thinking about it every day. And then I think the third thing is practices just sort of, underestimate just the logistical lift. Certainly at managing these patients at scale. There's a marketing component, there's a clinical care component, there's a technology component, there's a quality component, there's an education component, there's a patient experience component, and it just gets complicated, when you try to do all of that, at the practice level versus an enterprise level where we can really focus, efforts around all of those things. So, we've seen folks try it again. Typically falls into one of these three categories is what we see happens, and it sort of falls away in 6 months, 9 months. The program sort of leaves. We've had folks try it and then come back to us and say, "Hey, we tried it on our own and it didn't work, and so we'd like to work with you guys again." We've actually had that happen several times, and so we think that's a good thing. But it's not terribly complex, but it's just logistically complicated and requires a lot of focus.
I think one of the notes that you highlighted there is the patient component, the patient experience, the education of the patient, and I think that's one of the things that Tammy mentioned too as being very important to their practice is that the outcomes for the patient are really strong. Can the two of you talk a little bit more about what you're seeing in terms of patient outcomes and how this program is making a real impact on the lives of the patients that you're serving? Because I think that's at the core of everything that both of you are doing.
I'll talk about it just very briefly at sort of an enterprise level, and Tammy can certainly speak more to what they see in their practice. We see a large number of patients engage actively in the program, but not every patient. I will say it's not a fit for every patient. They have to be in the right state of mind. They have to want to engage in the program. They have to want to get better. And so our program is really built around, activating patients and improving that patient experience. And so, the patients have to sort of want to engage with us, and not all of them do, but most do. And most stay engaged for a long period of time, a year or greater. And so we've seen that. And if they do, we've seen a large number of patients graduate from our program. We track that every single month. So patients who no longer have chronic conditions that qualify for them for the program. And so that's great. That's a great story. We see our patient satisfaction scores that are very encouraging. About 94% of patients feel like their care coordinator cares about their well-being, right? That's a great thing in this, access to care challenge that we all face. About 92% of patients feel like the information they receive, the educational and motivational information they receive from us each month is valuable. And then we see north of 90% of patients who would refer a friend or family member to the program. So we see, patient satisfaction outcomes, we see clinical outcomes, we see patients that engage and stay in for a while. That's pretty typical across the board. We obviously see better outcomes in all of those areas when the practice is actively engaged as well. So for Tammy and the folks there in Evansville, she can speak to this more, but when the providers and the administrative staff within the practice are engaged as well, the outcomes are even better.
Yeah, I've even had patients who have called because they get a bill for it and they want to know what the bill's for. Well, I didn't realize I was paying that. I don't want this service any longer. And then literally the very next day they call back to MetaPhy or call to my office and say, "I'm sorry, I changed my mind. I really enjoy the service that I'm getting and it's worth what I'm paying for it." So, I think that they're always up for the free service. Sometimes they change their mind when they realize it isn't, but again, they realize the benefit of it and they enjoy having those conversations and they feel better being with the MetaPhy people, talking with them and getting a better way of life. And so they decide that it definitely is worth the little bit of expense that they're paying for it.
Do your physicians feel like it's making an impact on patient access to care and the way that they're caring for themselves and kind of following the physician's care plan?
They do, yes. They definitely can see the benefit in it. When they come in for a follow-up visit, they mention it to them. We're seeing, overall blood pressures come down, people's weight, people that are in for obesity. We see that their weights are coming down. Yeah, we definitely can see as time has gone on, because we've been on this for several years now, we can definitely see the benefit that the patients are getting out of it.
And just from your perspective, Tammy, as you think about what other things your practice is doing that is helping to make this particular partnership so successful, can you share a little bit more about what that looks like? What do you do specifically that makes this so successful and helps your patients be more successful within this program?
Well, to be honest, I feel like MetaPhy does most of the work. I mean, our
Unexpected plug.
It's true. I
We'll
mean,
take
our
it.
doctors, do make some specific referrals, but for the most part, it's the work that MetaPhy's team does to identify these patients with chronic illnesses, multiple diagnoses that need this treatment. They're the ones that reach out to the patient on behalf of our providers and just explain to them what this program is. And they're the ones that get them engaged and get them involved. So I have to give kudos for the most part to MetaPhy for that.
Well, I'm going to give kudos back, even though you're very kind to say that, and I do appreciate it. I would say the difference maker in this practice is really comes down to communication and collaboration, and we see this as a collaborative effort. And by the way, when there are problems, not if, but when there are problems, because there always are, we get on the phone and we connect and we talk about it and we work through them. So if there are payer issues, if there are issues with a provider not knowing something about the program, if we need to change the marketing strategy, whatever it is, Tammy and her team have been absolutely wonderful about reaching out to us, letting us know there's a problem, and then all of us getting on the phone and collectively, in a collaborative way, coming to a solution. And that's been transformative. We don't see that everywhere. We do see that here. And I think it's made the difference in the success of the program.
And when you think about that from the perspective of the average specialty practice, um, what does it look like to integrate the MetaPhy program into their existing processes and workflows?
Well, we've tried to make it really easy, and so but it does take about 90 days or so to get sort of launched and fully ramped.
That's
We
pretty
we have
quick in healthcare.
It is, and again, we've tried to make it low lift, and we've tried to do most of the heavy lifting ourselves. But there is an implementation phase where we develop marketing materials, we get access to clinical EMRs, we train the staff, we meet with providers, we do all of the things we need to do to just connect and get everything going, and that can take 30 days or so. Then there's the launch. We start reaching out to patients as they come to us, educating those patients, enrolling them, managing that. Then it's sort of, each month we go through that and it builds on the previous month. So providing the care plans back to providers for them to provide any input that they want to provide. We get the billing to Tammy and her team. They bill, they collect. And so there's a process, and it probably takes 90 days to run that full cycle before practices start to see, the success of the program. So yeah, we think that's pretty fast in the whole scheme of things. And we try to make it as easy as possible.
And in your experience, Tammy, it sounds like, the process of implementing and working with MetaPhy is very seamless on the practice side. What does the patient see as part of that process? I know you mentioned the integration with the EMR and kind of that seamless handoff. But what does the patient see once they're in the program, and how do they relate that back to the practice?
Well, MetaPhy basically represents themselves as being, part of our team, which they very much are part of our team, and that they are contacting on behalf of our physicians. So from the beginning, our patients feel like it is our program, not MetaPhy. They call it My Cares, but they don't even think about these other people. They think that they are us. They are part of our team. And that's, I think, one reason why they're able to get them on board so easily and get them involved, because they have trust in us, they have trust in our providers, so therefore they have trust in this program.
And trust, I think, is the huge thing. You have to be able to trust that the partner you're working with is going to care for your patients in the same way that you're caring for your patients. And I feel like I'm biased, obviously, because I know and adore the MetaPhy team, but I feel like they are so patient first that it's an easy trust transition for you to know that they're going to really deliver that same level of care to all of your patients.
Yeah, I think our patients appreciate the extra attention and the extra information that they get from the MyCare program over what we give them when they're here in the office. So we have very few patients that opt out of the program. And again, those that do, it's typically because they're on a Medicare Advantage plan with copays, and
Okay.
they can't afford it or don't want to afford it. But from a revenue perspective, MetaPhy is very easy to work with, very responsive in addressing issues, concerns, and I feel that they're always working to make the program better and help the practices they support be successful.
I feel like this is a resounding testimonial to the experience that any practice could expect to have with MetaPhy. And coming from someone who is, first of all, running a practice that is really, really sophisticated and obviously has a pretty deep vetting process for any partners that you're working with, and has very high expectations of the partners that you're working with. That's such an honor to have that great feedback coming from you, Tammy. But I just so appreciate you joining us today to talk about this, because I know that the systems and tools and practices that you have in place are really leading the industry. And so your feedback is really invaluable as we talk more about how the program evolves and changes for the future, and what other practices could get out of a partnership like this.
I appreciate the opportunity to be able to share with you.
Chris, thank you so much for having this conversation. I feel like your insight is truly invaluable. I feel like you give such excellent advice to practices who are looking to grow and looking to create the future and adapt to all of the new rules and regulations and CMS that are coming out, and the new reimbursement opportunities that exist out there to both help their patients and also help their practice. Thank you so much for joining us today. We are thrilled that Tammy and Chris were able to chat more about the ways that you can integrate chronic condition management as a service line for your practice. If you'd like to learn more about the solutions that you can partner with MetaPhy on, you can click the link in the chat right now to schedule a call with the amazing MetaPhy team. And if you'd like to get in touch with either of our speakers today, there are links in the chat as well for you to send them an email or connect on LinkedIn. We will see you next time.
Thank you.
Thank you.